afternoon. I am Mary Elizabeth Reiss, and I am an end-of-life doula. And I'm just going to talk a little bit about what is an end-of-life doula and why did I choose to be an end-of-life doula. First thing I'm going to tell you is it's not all about dying. I really bill myself more out as a midlife companion or midlife doula. And what's really important is to normalize death discussions and the things that are important to you now so that you can live your best life in all the years ahead. And some of the things that we do as a death doula or an end-of-life doula at the end of life include sitting with patients, holding vigil. I volunteer with hospice. But if we move it up like 10, 20, 30, 40 years and we move it into the midlife realm or even younger, I work with people to put in place advanced directives. And I feel this is really important at any age because advanced directives identify who, if you end up in the hospital unconscious, the medical team should call. And if there are circumstances where you need to be plugged into devices, given medications, what are your wishes? Who are the people that you really want making those decisions for you? And that's what an advanced directive puts in place. I offer complimentary advanced directives in all 50 states. And in that advanced directive, there are different conditions and circumstances. So things may change. You can amend it at any time. And it's not a one-size-fits-all. It's not the same solution for every environment or situation. So that's one thing we do. The other thing we do is we work with clients and people to put in place what's called life review. And this, again, is something that can be done at any age. I recommend starting early, maybe, touching it up along the way. And what this is looking at life. I categorize the life reviews I do with my clients into 5 or 6 different categories, from childhood all the way through relationships, education. And if I have an older client, it's usually I'm at their end of life when we're talking this through. And we tell the stories that are significant about those periods of time in their lives. And we may put pictures with it, we may put mementos. Often there's videos with life reviews. This all gets put together into a package that tells the story. It tells the story of your life for you, for your loved ones, for your kids, grandchildren. It's something that is a legacy that you leave. And I find it really healing for people, no matter what age they go through this. There's so much stuff that comes up, unfinished business, relationships that need closure, just really great memories that bring up gratitude. And I will tell you, so I am an end-of-life doula. I chose to do this. I'm also a life coach, and so I bring in my holistic life coaching skills, and I marry them up with the end-of-life practice, and anything else that goes with that, yoga, Reiki, energy work. I reach out and refer to other people as well. I do this because this is where my heart's desire is. I really enjoy being with people. And in this country, we don't really talk about death very often. But I really find it's important to talk about it today. And how can we prepare if you're 20, 30, 40, 50, 60 to really enjoy the rest of our life? When you get to the middle of your life and to the last third of your life, what preparation did you make in your younger years to make sure they are the best years of your lives? Mentally, physically, emotionally, and that's everything. That's nutrition, that's mental health, that's spiritual health, and then that's preparation, and that's the nitty-gritty piece of this. That's the legal paperwork, that's the advanced directives. We have something called Ed Notes that I work with an organization called Peaceful Presence. It's a nonprofit, and they've developed Ed Notes. That's a document that puts all your information in one place. Where are your passwords? Where are your legal documents? Where are your financial documents? This document, start to finish, is a gift to you and the people that you leave behind. So it's a way that they know how to go through everything without struggling and looking and stressing. It gives them some peace of mind and some comfort in knowing that it's all there and planned out. So that's why I'm an end-of-life doula. It really is something that I felt called to do. I've been involved, I've sat with people most of my adult life, and it is truly something that's within my heart and soul and my passion. So thank you for letting me speak and listening, and I hope, if you are interested, you'll look me up and take advantage of the complimentary advanced directive, because like I said, it's really important at any age. It takes about 15 minutes, it's confidential, and I'll help you through it. So thanks so much.